the environment necessary for all diseases to proliferate. It's toxicity and nutritional deficiencies at a state of being unfit. Are your cells subclinically dehydrated? This is what you learn when you're nutritionally tested. Things that you really should know about to take care of yourself and not be depending on a system which is failing. So here's, I'm going to go through quickly 30 incredible benefits of nutrition testing and personal health evaluation. One, know the exact nutritional needs based on your individual biochemistry. So it's not some guru or some book or some guru or TV or radio announcer or some seminar telling you, here, take these vitamins because they're good for you. They may be good, they may not be good for you. So by being tested, you know exactly what your nutritional needs are based on your individual biochemistry. 2, learn what foods are compatible and incompatible with your individual biochemistry. 3, take all the guesswork, trial and error, and the confusion out of your nutritional needs. 4, discover the systems of your body that are underperforming and what to do about it. 5, know your body's exact hormonal needs and how to resolve them with natural foods, nutritional supplements, and natural bioidentical hormone restoration. 6, fight disease long before it gains its foothold by catching potential problems at the subclinical deficiency stage rather than the pathology stage. 7, stop premature aging in its tracks by discovering how much your hormones are in the pits, how much human growth hormone is being released from your pituitary, and then addressing those deficiencies with nutritional support, or, if indicated, bioidentical hormone restoration therapy. 8, discover your thyroid gland, whether it's underperforming, and then address that with nutritional supplementation, foods, and making corrections in your dietary, and if necessary, bioidentical natural thyroid hormone restoration. Don't wait for some serious disease of the thyroid, or find out that you've gone a whole lifetime and the thyroid has been less than optimum. And in our form of evaluation, we're not looking for thyroid disease, we're looking for anything less than optimum. Because if your thyroid is working less than optimum, then your brain, your nervous system, your metabolism, your body fat, how it burns this fat, how your body works and your mind works is all dependent on thyroid optimization. We don't want to wait until disease sets in. 9, discover if your pineal gland is underperforming and if your body clock is out of whack and affecting sound sleep necessary for repair patterns. 10, discover if your adrenal gland is stressed out and how to restore it with natural adrenal hormone restoration. 11, discover nutritional cause and effect relationship with your primary discover the nutritional cause and effect relationship with your primary health challenges. 12, discover your metabolic energy leaks. 13, discover why you are gaining fat and losing muscle. 14, convert your sluggish, ineffective fat-storing metabolism into a highly efficient, high-energy, fat-burning dynamo. 15, use the latest scientific breakthrough in blood diagnostics to evaluate your level of high-level wellness. 16, uncover subclinical nutritional deficiencies before they become named medical conditions. 17, equip yourself so you can be your own best nutritional doctor. 18, catch fat weight gain at the metabolic level before it begins to accumulate in your body. 19, catch hormonal imbalances early before they become full-blown problems. 20, stop premature aging in its tracks and reverse the process. 21, build an indestructible immune system. 22, wipe out the nutritional cause of the depression. Never drug this, but do not drug it if your body needs nutrition. Antidepressants only make the condition worse, and if you are deficient, you must deal with deficiencies. Nobody was ever found to be scientifically deficient in a antidepressant drug. 23, regain your youthful libido and do it naturally without sex drugs. 24, regain mental clarity and focus. 25, regain vitality and vital energy. 26, build nutritional soundness. 27, normalize blood pressure naturally. 28, strengthen your entire cardiovascular system. 29, nutritionally strengthen and support every gland, system, and nerve of your body and every cell of your body. And 30, build inexhaustible reserves. It's now possible for you to build an indestructible immune system. We have the science. We have the knowledge now. We're in a day and age where it is possible to prevent and to build a very powerful immune system. If you feel this type of evaluation makes sense to you, I want you to call your medical doctor and ask him if he can provide this service or if he can refer you to someone who can. You may be surprised to learn that a highly specialized service of this type that cross-correlates 75 different diagnostic laboratory tests with the most extensive symptoms analysis developed to date for personal nutritional assessment based on individual biochemistry, that the fee could be anywhere between $3,500 and $5,000 and no insurance reimbursement. At Abunda Life, we have 4 different evaluation profiles to choose from. Our basic test is the Abunda Life NutriBalance or nutritional testing profile. A lot is included, about 75 diagnostic blood and urine tests. Iridology are included to determine your constitutional strengths and your weaknesses. At your initial visit, you will complete the Abunda Life Naturopathic Doctor's 1001 nutritional testing and personal health evaluation questionnaire, the most extensive questionnaire developed to date for nutritional assessment purposes.
Yes,
also,
it's still running.
The most time-intensive service that you don't see, and that is the analysis of cross-correlation of this data for nutritional, hormone, and metabolic assessment. On your return report of finding visit, pages and pages of 21st century computer data will be explained to you in detail, and a nutritional protocol and consultation and definitive recommendations based on your individual biochemistry will be provided. The total cost of $1,200 in laboratory fees, plus about 6 hours of professional time and professional counseling, is included for a fee of not $5,000 or $4,000 or $3,000 or $2,000 or even $1,000. As amazing, as unbelievable as it may seem, we have as a special introductory office analysis for a limited time of only $597, as ridiculous as that might sound. Prices will be going up soon. Additional profiles are available. The diagnostic laboratory that we use does over 5,000 different specialty tests. At present laboratory sciences that are now presently 10 years ahead of the standard daily practice of medicine. Laboratory tests are available that can detect cancer antibodies in an antibody stage rather than the after the fact stage, long before cancer has been officially diagnosed. This laboratory science is also available to determine stroke, heart disease, diabetes, Alzheimer's, premature aging, and so much more. Not months, but years, even decades before they are diagnosed. So bioidentical hormone testing, growth hormone testing, amino acid allergy testing, adrenal burnout testing, inflammation testing, and many, many more amino acids, allergies, and all of these testings are available. You are entitled to a free phone consultation. So any questions you might have, simply call me, 732 area code 775-7575. If I'm busy with patients, please leave your phone numbers, all your numbers, times that you're most readily available, and a brief message concerning your questions and the problems that you'd like to address. I'll get back to you personally, or a member of my staff will discuss these concerns with you. So I want to thank you for listening to this message, and just have a healthy, Abunda Life day. And remember, a single ounce of preventative nutritional medicine is worth a ton of the medical cures after the fact.